So my name is Jean Palin. I'm a family nurse practitioner. I work for Community Health Center at a school-based health center, New Britain High.
Okay, the first big question is, why do you precept?
So I precept because I really feel it's important to educate the next generation of nurse practitioners. I enjoy working with nurse practitioners, and I really enjoy teaching. I've been doing it for the last 18 years.
And what are some important skills to have as a preceptor?
I think the time to spend with each student when after they've seen a patient, and then listen to make sure they're doing the history correctly, the physical, and then going back in the room and going over the whole thing with the patient and the student.
And what advice would you give someone who is thinking about precepting?
Make sure you have the time. Time is really important. If you have to rush through, the student isn't going to learn what she needs to learn. So I think time is a big thing. The other, you have to really enjoy what you do. And if you find it more of a burden, it's not for you.
That's good. And what do you find most rewarding about precepting?
The students. I actually do learn different things from the students. They help me keep up to date, because that's very important. I'm an older nurse practitioner, so I've had a couple of nurse practitioners who have really teach me different tricks on the computer to make things more efficient, and which has been really helpful.
That's awesome. And what advice would you give students to help prepare them to get the most out of this experience?
I think especially, the most important thing probably is to make sure that you have a preceptor who understands what your goals are, okay? The first preceptor I ever had years ago, as soon as I walked in the door, told me he didn't believe in the role of the nurse practitioner. So I'm not sure why he was a preceptor, but I spent that 6 weeks I had with him just shadowing him. He didn't allow me to touch a patient. Mm-hmm. So I think it's very important that the nurse practitioner and preceptor know what your goals are, and that you can achieve what you want to achieve as well.